We have a number of medications that can help dementia patients. And there are mainly two groups. The first group is the cholinesterase inhibitor. And the most common medication for this group is Aricept. This medication is very popular in USA, in Europe, and even in Asia. And what does that medicine doing is they increase the concentration of acetylcholine in the brain. As we know, the acetylcholine is the transmitter of the neuron cells, in the brain. So if we can increase the concentration of that, we might help the dementia. We can help try to preserve the memory function of the patient. The second group of medication we're going to talk about is Memantine. The most popular medication for this group is Namenda. This medication is mainly for the moderate to severe dementia. Pretty much for the early onset of dementia or early stage of dementia, we use the Aricept in the first group. And for more advanced dementia, we can try to put them on Namenda. And sometimes, patient might benefit from the combination of two medications. And there are, other medications that help the dementia patients, especially when they develop the complication from dementia, such as insomnia, depressions, delusions, or anxiety. Those medicines are pretty much aimed for helping those symptoms. So besides the medications, we can help the patients for dementia with some non-medications treatment. Okay, those are the non-drug therapy, okay? And we're going to go through all this therapy very briefly. The first one is the behavioral therapy. If you know psychology, I'm sure you understand what behavior therapy means. We always try to use some reward to enhance some good behavior. And we use the punishment to diminish some bad behavior. Let me give you an example. Let's say an old lady, she always try to sneak out from home in the middle of night. And her daughter need to educate her, please not to go out in the middle of night because it's dangerous. If you don't go out in the middle of night, then I will bring you for some dim sum. So that is something she really likes. So you try to enhance the behavior, try to avoid to have her going out in the middle of night. So you present it with a reward, and hopefully that will help her to correct her behavior. That is the principle of behavior therapy. Okay, so it's very straightforward. And the next one is cognitive therapy. During this therapy, we try to preserve the cognitive functions of dementia patients. The therapies can do a lot of cognitive training on a computer nowadays, and just by practicing all this computer software, the patient can kind of preserve the cognitive therapy, the cognitive function a lot. Music therapy, that is pretty much like self-explanatory. You're playing a lot of music, soft music to the patients, and that can help their anxiety, that can help the depressions. Reminiscence therapy, okay, that is another therapy the therapists like to use a lot. Patient can get a lot of satisfaction, increase ability to communicate, increase the self-worth of belonging by sharing their old photos, their old belongings. So that really help the patient a lot sometimes. Aromatic therapy, there's another therapy a lot of therapists like to use is they try to give some essential oils to the patients, and that can help the patients for treating all their symptoms, including the anxiety, insomnia, or even improve their memory. Sensory therapy is an effective method for, once again, reducing the anxiety, calming the nerves, and providing comfort. It can be as simple as like a hand massage with some lotions, or listening to favorite music. Pet therapy, I see a lot of patients in the elderly, in the nursing home. When I go to see them, sometimes I bump into people bringing in a lot of pets. The pets actually can help a dementia patient to be more interactive when sometimes they are not able to do so in social setting with like other adults. The pets can help them. It can reduce the anxiety, reduce the agitation, depression, and the loneliness. Bright light therapy. There are many dementia patients have sleeping problems, and as a result of that, they have difficulty in maintaining their daytime functions. So the recent study showed that a lot of people may benefit from bright light therapy, and that help them to sleep better at the middle of night. Okay, so basically, all 8 types of therapy and helping to preserve or maintain the dementia patient's functioning and their independence. But one of the many key points is the family members, play a very major part in taking care of patients. They need to have a lot of love, patience to their family members, so that that can help the patient to live like longer and have a more independent life. Okay, come to the very last slide. I will give you some tips about how to prevent dementia. And those 9 points here are all evidence-based. They are proven to be effective. The first one is apple. Okay, it's very simple. And Chinese always believe, eating an apple every day and you can keep away from your doctor. That is very true. And they find out apple, has a special function of preserving people from getting dementia. They do a lot of studies, especially on those rats, and they give one group of rats, with apple juice every day, and the other group with just plain water. And after a certain period of time, they found out, the rat who drink apple juice every day, they are doing much better in terms of their mental functions. So apple is definitely is a good add-on for patients who want to prevent from getting dementia. And the second one is curcumin. Okay, curcumin, how we find out curcumin is effective in dementia. Doctors, notice that people in India, they has a very less chance of getting dementia. The incidence of dementia in India is much lower compared to the rest of the world. So they try to look into their diet, and they found out the curcumin is a very popular material or food inside the Indian curry. So they do a lot of other research as well. Some, researcher at UCLA, they publish a number of papers talk about curcumin. So they found out the curcumin really have a role in preventing dementia. So nowadays, you don't have to eat a lot of curry in order to get curcumin. You can take the curcumin capsules. They do sell it in the drugstore, at the Costco, so you can get them easily, and you can take the curcumin on a regular basis. That will be very helpful. And the next one is regular exercise. Once again, exercise not just good for your heart, not just good for your lung, it's really good for preventing dementia as well. And more you can do is not just doing the physical exercise, you can also do some brain exercise. We call it the brain training. And you can use your brain more and more, and then you have a lower chance to get dementia. I think, the previous theory we had is totally wrong. We always think, in order to preserve your brain, you better use it less. But that is proved to be wrong nowadays. And in order to get, to prevent dementia, you need to use your brain as much as you can, okay? Such as playing mahjong, playing cards, or learning a new language, and that all helpful to prevent dementia. So, the simple recommendation is use your brain as much as you can, okay? And the next one is stay positive, okay? We don't have to be in miserable mood all the time. You have to keep everything positive, keep our mind positive. That will help, not just for dementia. That will help in terms of helping boost up your immunosuppressive immunizations, okay? That helps you to protect from all the bacterial infections. Expose yourself to sunshine, that will replenish your vitamin D deficiency, and that will help to prevent dementia as well. Higher education, as I mentioned in the very first couple of slides, country with high social or salary pay, they get high education level. In other words, they have less, people get dementia. That's the reason behind it. So as people in America here, people are getting a lot of good opportunities to get high education. And that's why the dementia population in USA is relatively low comparing to other low social class country here. Adequate sleep is also important. We talked about vascular dementia before, and as we know, vascular dementia is a result of multiple and recurrent stroke. And by controlling the blood pressure, cholesterol, and the diabetes, we got less chance to get complication from the disease of stroke. So that indirectly helping out to decrease the chance of getting dementia. Well, that is all the slides I need to talk about.
Thank you so much, Dr. Chang, for sharing this valuable information on the topic of dementia and also giving us some secret tips to prevent dementia as well. If you like this video, please share and like, and most importantly, subscribe our channel.